I grew up in Canby, Indiana. It's a pretty tight-knit community. Pretty much everyone knows everybody. I came from a single-parent family down in Mooresville. When it came to choosing a specialty that happened to be in primary care, it was somewhat on purpose, somewhat on accident. I knew what I wanted out of medicine. I knew that I wanted patient contact, I wanted longitudinal care, I wanted preventative medicine. It's awesome at IU specifically that our entire third year we get exposed to everything imaginable. For me, it happened to be primary care. I got all of the things that I wanted out of it, and it just so happened that, we have a great internal medicine program here too, so I got to stay in my hometown and take care of the people that I, live amongst.
Growing up in Huntington, my first initial interactions with primary care happened really in middle school from a sort of shadowing experience that my dad helped set up with his family practitioner. I think my interest in medicine really started from a place of service. I was a Boy Scout growing up. Through the Boy Scouts, I did a lot of community service, whether it's ringing bells at the Salvation Army, doing community service projects out in the community. I really found a strong fulfillment and satisfaction from sort of having a service mentality, and had a lot of people invest in me and felt that paying that back in the form of service was sort of fulfilling to me. So what led me towards pediatrics was being able to interact with younger people in my community. I really found pediatricians to be really trusted kind of members of their community, and people that are able to sort of be cool and handle crisis when parents come to you with concerns and fears about their children. And
so the INPACT scholarship, it does have the opportunity of giving people support to go into fields that are necessary, that are vital to people's health, and that are going to be a part of that preventative medicine and that longitudinal care. Things like knowing that those resources are even available even before coming to medical school or early into your education as a medical student, just so that way it's always on the back of your mind that hey, you could be doing this thing that you love, but there's going to be resources to help you out, so that way you can pursue that field that speaks to you and gives you access to these patients who need help. It is a significant amount of money that could help somebody go into a position like primary care.
One of the things that really sort of cemented my interest in pediatrics was some of the experiences I had as an undergrad, working at summer camps for kids with chronic illnesses. The INPACT scholarship seemed like a really great opportunity to sort of solidify some of those interests and kind of ease some of the kind of financial burden that is sort of stigmatized around primary care, that you have to take a pay cut and that it isn't as profitable. Things like the INPACT scholarship certainly opened up a lot of opportunities.